No ambulances, no blood banks, no surgical theaters. Ottoman military campaigns lasted months in territories where the nearest doctor was continents away, yet their armies maintained combat effectiveness while European forces were decimated by treatable injuries and diseases. They developed emergency medicine systems that worked without external support, using techniques that could save lives when every modern medical system has failed. What you're about to discover isn't just medical history. These are proven techniques that kept Ottoman armies fighting across 3 continents using nothing but portable medical knowledge and natural materials. From battlefield surgery performed by torchlight to herbal anesthesia that actually worked, Ottoman field medics mastered skills that could prove invaluable when modern healthcare isn't available. And here's what makes it incredible. They achieved survival rates that would impress modern trauma centers, using methods so reliable that contemporary military medics still study Ottoman battlefield medicine. If you're interested in medical knowledge that works regardless of technology or infrastructure, hit that subscribe button because we're diving deep into emergency medicine wisdom that modern doctors are rediscovering. When Ottoman armies moved across hostile territory, they carried complete surgical capabilities that could be deployed anywhere within minutes. Modern military medicine experts study these systems because they achieved something our field hospitals struggle with: comprehensive surgical care using only portable equipment and systematic knowledge. The foundation was modular surgical kits designed for maximum versatility in minimum space. Ottoman military surgeons carried instrument sets that could handle everything from routine wound care to complex bone setting, all contained in leather cases small enough for horseback travel. These weren't crude battlefield tools. They were precision instruments crafted specifically for field conditions. Every instrument served multiple purposes through ingenious design that maximized utility while minimizing weight. Surgical knives doubled as dissection tools, bone saws converted to amputation instruments, and clamps functioned as both hemostats and tissue retractors. Ottoman surgeons could perform dozens of different procedures using tool sets that modern surgeons would consider impossibly limited. But tools were meaningless without the knowledge to use them effectively. Ottoman military medics underwent extensive training that covered everything from anatomy to pharmacology, all focused on conditions they'd encounter in the field. They learned to perform surgery by feel when lighting was poor, work quickly when under enemy fire, and improvise when standard procedures weren't feasible. The surgical workspace was equally systematic. Ottoman field medics could establish sterile operating areas using portable screens, ground covers, and lighting systems that worked in any environment. They understood infection control principles that prevented most surgical complications, using methods that modern medicine has validated as scientifically sound. Quality control was rigorous, because surgical failure meant losing valuable soldiers. Instruments were maintained to exacting standards, sterilization procedures were followed religiously, and outcomes were tracked systematically. Ottoman military surgeons had to justify their methods with results, creating continuous improvement that refined techniques over generations. Emergency protocols covered every conceivable battlefield scenario. Surgeons could operate during active combat, handle mass casualty situations, and maintain surgical capabilities while retreating under fire. They developed triage systems that prioritized treatment based on survival probability and strategic value, maximizing lives saved with limited resources. The most impressive capability was surgical innovation under extreme conditions. When standard procedures weren't possible, Ottoman field surgeons improvised techniques that solved problems no textbook covered. They regularly developed new surgical approaches that were later adopted by civilian medical practitioners. This surgical flexibility made Ottoman armies extraordinarily resilient. Soldiers knew that injuries wouldn't end their military careers if they could reach medical care, creating confidence that enhanced combat effectiveness. While European armies lost experienced fighters to treatable wounds, Ottoman forces recycled injured soldiers back into combat units. Your surgery gets cancelled because the anesthesiologist is unavailable. Ottoman field surgeons performed complex procedures using natural anesthetics that worked reliably without modern equipment or pharmaceutical supplies. They developed pain management systems that enabled surgery in conditions where screaming patients would attract enemy attention. The foundation was systematic knowledge of plant-based anesthetics that grew throughout the territories where Ottoman forces operated. Military surgeons could identify, prepare, and administer natural compounds that provided effective pain relief and surgical anesthesia using local vegetation and traditional preparation methods. Opium-based preparations were the primary surgical anesthetic, but Ottoman medics understood dosage, timing, and administration methods that maximized effectiveness while minimizing dangerous side effects. They could calculate appropriate doses based on patient size and procedure complexity, ensuring adequate pain relief without respiratory depression. But opium wasn't always available, so Ottoman surgeons mastered alternative anesthetic compounds derived from common plants. Mandrake root provided deep sedation suitable for major surgery, while willow bark offered pain relief for minor procedures. Cannabis preparations helped manage chronic pain and reduce surgical anxiety. Local anesthetics use readily available materials to numb specific areas during procedures. Alcohol applied topically could desensitize tissue for superficial surgery, while cold applications using snow or ice provided temporary numbness for quick procedures. These techniques enabled surgery when systemic anesthesia wasn't feasible. The most sophisticated approach was combination anesthesia that used multiple compounds to achieve optimal surgical conditions. Ottoman surgeons combined sedatives for consciousness reduction, analgesics for pain relief, and muscle relaxants to prevent movement during procedures. This multi-drug approach provided better surgical conditions than single compound anesthesia. Pain management extended beyond surgery to include chronic pain treatment and injury rehabilitation. Ottoman military medics understood which natural compounds provided long-term relief without creating dependency, and which treatments accelerated healing while managing discomfort. Patient preparation involved systematic protocols that optimized anesthetic effectiveness while minimizing risks. Surgeons evaluated patient condition, calculated appropriate dosages, and monitored responses throughout procedures. They could adjust anesthetic levels based on patient reactions and procedure requirements. Honestly, watching modern hospitals postpone surgeries because they can't get anesthesia supplies while Ottoman surgeons performed the same procedures using plants they found growing outside is pretty humbling. If you're starting to realize that our medical system might be more fragile than we thought, definitely hit that like button because we're just getting started. Modern trauma centers take 15 minutes to prep for emergency surgery. Ottoman field surgeons could begin life-saving procedures within minutes of injury, using systematic approaches that stabilized patients and treated wounds that would kill people without immediate intervention. The foundation was rapid assessment protocols that identified life-threatening conditions and prioritized treatment based on survival probability. Ottoman military medics could evaluate multiple casualties simultaneously, determining which patients needed immediate surgery, which could wait, and which were beyond help. Hemorrhage control used techniques that stopped bleeding quickly using materials available on any battlefield. Pressure points, tourniquet applications, and wound packing methods controlled bleeding, while surgeons prepared for definitive treatment. They understood which bleeding could be managed conservatively and which required immediate surgical intervention. Wound cleaning was essential because infection killed more soldiers than initial injuries. Ottoman surgeons used systematic irrigation techniques that removed debris and contamination using boiled water, wine, and herbal solutions with antimicrobial properties. They could sterilize wounds in field conditions without modern antiseptics. Surgical procedures covered everything from simple wound repair to complex bone setting and limb amputation. Ottoman field surgeons could suture tissue using silk thread or gut, reduce fractures using traction and splinting, and amputate limbs when necessary to save lives. Their surgical skills rivaled anything available in civilian hospitals. The genius was systematic surgery that followed established protocols regardless of conditions. Ottoman surgeons used standardized approaches for common injuries, ensuring consistent results even when working under stress. Muscle memory and systematic training enabled effective surgery even in chaotic battlefield conditions. Infection prevention used traditional methods that modern medicine confirms as effective. Honey applications prevented wound infections, silver preparations controlled bacterial growth, and specific herbal compounds provided antimicrobial protection. These natural antiseptics often worked better than early synthetic alternatives. Post-operative care included systematic monitoring and treatment that prevented complications and accelerated healing. Ottoman medics understood which signs indicated healing versus infection, and which interventions improved recovery outcomes. They could manage surgical patients through complete recovery using only traditional methods. Your pharmacy runs out of antibiotics and pain medications. Ottoman military medics operated complete pharmacies using medicinal plants that grew along campaign routes, creating natural pharmaceuticals that treated everything from infections to chronic diseases. The foundation was comprehensive botanical knowledge that enabled identification, preparation, and administration of hundreds of medicinal plants. Ottoman military surgeons could recognize therapeutic plants by sight, understand optimal harvesting times, and prepare medications that provided consistent therapeutic effects. Antibiotic alternatives used plant compounds that modern research confirms as genuinely antimicrobial. Garlic preparations fought infections, echinacea boosted immune responses, and tea tree compounds provided topical antiseptic effects. These natural antibiotics often worked when synthetic alternatives failed. Pain medications derived from common plants provided relief comparable to modern pharmaceuticals. Willow bark contained natural salicylates, similar to aspirin. Valerian root offered sedative effects, and capsicum preparations provided topical pain relief. Ottoman medics understood dosage and administration for optimal effectiveness. Digestive medications treated the stomach problems that plagued military campaigns. Ginger prevented nausea during transport, peppermint settled upset stomachs, and specific herbal combinations treated dysentery and other digestive infections that could disable entire units. Respiratory treatments addressed breathing problems common during dusty campaigns and cold weather operations. Eucalyptus preparations cleared congestion, thyme compounds fought respiratory infections, and steam inhalations using aromatic herbs provided immediate relief for breathing difficulties. The most sophisticated approach was combination therapy that used multiple plants to achieve enhanced therapeutic effects. Ottoman medics understood which plants worked synergistically, which combinations were dangerous, and how to formulate complex preparations that addressed multiple symptoms simultaneously. Quality control ensured medication safety and effectiveness through systematic testing and preparation standards. Military pharmacists evaluated plant quality, standardized preparation methods, and tracked patient responses to refine therapeutic protocols. They maintained consistent medication quality using only traditional methods. Emergency protocols covered situations where standard medications weren't available. Ottoman medics could substitute alternative plants, modify preparations based on available materials, and maintain therapeutic capabilities using whatever vegetation grew locally. Modern surgery requires sterile operating rooms and complex equipment. Ottoman field surgeons performed procedures that save lives using techniques so advanced that contemporary military surgeons still study their methods for treating injuries in resource-limited environments. Bone setting was essential because fractures could permanently disable valuable soldiers. Ottoman surgeons understood anatomy well enough to reduce complex fractures by feel, set bones using traction and leverage, and splint injuries using materials found on any battlefield. Their orthopedic skills often produced better outcomes than early modern treatments. Wound repair required suturing techniques that closed tissue securely while minimizing scarring and infection risk. Ottoman surgeons used different stitching patterns for different tissue types, understood which wounds healed well with primary closure versus secondary intention, and could repair damage that would challenge modern trauma surgeons. Amputation was performed when necessary to save lives using systematic approaches that maximized patient survival and functional outcomes. Ottoman surgeons could amputate limbs quickly to control hemorrhage, shape stumps for optimal healing, and manage patients through recovery without modern prosthetics or rehabilitation services. Internal surgery was limited but included procedures that addressed life-threatening conditions. Ottoman surgeons could repair some abdominal injuries, drain internal infections, and remove foreign objects using techniques that required extraordinary skill given their limited diagnostic capabilities. Eye surgery addressed injuries that could cause blindness, using delicate techniques that preserved vision when possible. Ottoman surgeons could remove foreign objects from eyes, repair traumatic injuries, and treat infections using precision that modern ophthalmology respects. The most impressive capability was emergency surgery performed under combat conditions. Ottoman field surgeons could operate while under enemy fire, maintain sterile technique in dusty conditions, and achieve successful outcomes despite circumstances that would overwhelm modern surgical teams. Innovation happened because field conditions presented challenges no textbook covered. Ottoman surgeons developed new techniques for treating unusual injuries, modified standard procedures for battlefield conditions, and created surgical innovations that were later adopted by civilian medicine. Today's medical infrastructure collapses when supply chains fail, power grids go down, or hospitals reach capacity. Ottoman emergency medicine offers alternatives based on knowledge and natural materials that work when technological systems aren't available or functional. Modern hospitals depend on complex supply chains for everything from surgical instruments to pharmaceuticals. When deliveries are delayed or supplies run short, medical care suffers. Ottoman techniques demonstrate how medical knowledge and local resources can maintain healthcare capabilities regardless of external supply availability. Power dependency makes modern medicine vulnerable to electrical failures that shut down essential equipment. Ottoman methods worked without electricity, using techniques that provided effective medical care in any environment. This independence becomes increasingly valuable as infrastructure proves more fragile. The most relevant lesson is knowledge-based medicine that depends on human expertise rather than technological complexity. Ottoman medical practitioners achieved excellent results using traditional methods that worked anywhere. This approach offers resilience that technology-dependent medicine cannot match when systems fail. Personal applications include first aid knowledge and basic medical skills that provide healthcare capabilities when professional medical care isn't available. Understanding wound treatment, pain management, and infection control using natural materials could prove invaluable during emergencies or disasters. Community resilience benefits from distributed medical knowledge that creates local healthcare capabilities independent of centralized medical systems. Communities with traditional medical knowledge could maintain health services during disruptions that overwhelm conventional healthcare infrastructure. Economic advantages exist for people who understand traditional medicine that provides healthcare using local materials and natural methods. These approaches could enable healthcare delivery in areas where conventional medicine is too expensive or unavailable. Ottoman field medicine proved that human knowledge and natural materials could provide excellent medical care without technological dependency or external supply. In our increasingly fragile medical infrastructure world, maybe it's time to learn from medics who never experienced supply shortages because they never depended on systems beyond their control. Thanks for exploring emergency medicine mastery that modern doctors are scrambling to understand. If these techniques impressed you, smash that subscribe button and hit notifications because we've got more medical knowledge that could save your life when hospitals aren't available. Drop a comment telling us which Ottoman medical technique amazed you most: the natural anesthesia, the battlefield surgery, or maybe just the fact that they never canceled operations due to supply shortages. Share this with anyone who thinks modern medicine is as reliable as it gets, and show them what real medical resilience looked like. Because here's the reality check: Ottoman field surgeons operated for 400 years without supply chain problems or infrastructure dependencies. Modern hospitals struggle to function for 24 hours without deliveries. Maybe they knew something about medicine that we've forgotten in our rush to technologize everything.